eggs. And the third most damaging was Parmesan cheese. This is where you powder cheese up. You're heavily oxidizing it. And it actually was tied with lard. That's not a misprint. Both of them were tied for the third worst type of cholesterol. But actually, his study actually explained something else. I should say this. Some mothers, the way they eat, they're eating at McDonald's, fast food places, saturated fat cholesterol. They have more cholesterol in their human breast milk than what cows have in their milk. And there was a study done a few years prior to Bruce Taylor's study showing that some infants begin to get the fatty streaks of atherosclerosis in infancy. Which infants do you think tend to get it? Those consuming cow's milk or those consuming human breast milk? Most of you are saying cow's milk. Why might that be the case if the cow's milk is lower in cholesterol? Well, you're actually right. The human breast milk, those consuming human breast milk had no vascular damage. And the reason why is the way babies consume human breast milk is how? Directly from the nipple. It's not exposed to the air. The cholesterol is not oxidized. So the best way for you to drink your cow's milk would be go down to the barn and get it straight. Interesting, years ago, Ellen White was also ahead of her time. This is the book Ministry of Healing. Especially harmful, she said, are the what? Custards and puddings in which milk, eggs, and sugar are the chief ingredients. The free use of milk and sugar together should be what? Avoided. Then it's now well established that one of the main characteristics of virtually all depressed individuals, no matter what the underlying cause, is a significant decrease in the frontal lobe's blood flow and activity. This is a PET scan. It's like Doppler weather radar. You can see the depressed individual has a depressed brain. Not a lot of activity there. But this is the same brain after they've recovered from depression. Notice the biggest before and after difference is in the frontal lobe of the brain. And this is why our program is comprehensive and deals with the spiritual aspect. And I must admit, we do have an individual that does a great job on the spiritual aspect. I call him a spiritual congruence therapist. Most of our individuals with depression, when they fill out their spiritual inventory, they have significant problems with God. Many of them don't even think God exists anymore, or if he did, why isn't he caring about them? Why has he abandoned them? So many of them feel abandoned by God, wondering about the existence, having all sorts of issues, and their belief system is kind of all over the place in regards to not being congruent. Now, we don't change necessarily their worldview per se, because we only have 10 days with them, but within 10 days, they have their dots lined up spiritually, and they are totally receptive to the power of God in their lives, and they are thrilled with the spiritual recovery that they've also undergone as part of their program. And as I mentioned yesterday, for those of you who are here, in order to have complete and total transformation, that spiritual component is necessary, because God does have the ability and desires to influence them if they will allow his love into their hearts. Drevitz presents compelling evidence that frontal lobe problems are the cause and the effects of the depressive symptoms, so we have to reverse that. Then there are general treatment measures. After I studied causes of depression, I then began to study general treatment measures, things that help virtually anybody with depression. And what I was surprised at is there's just as many beneficial treatments as causes. How many causes did I find? Over 100, 10 categories, but total causes over 100 causes. How many beneficial treatments are there? Over 100. And although many of these modalities rigorously tested and proven, most not utilized in standard practices. Why is that the case? It has to do with the economics of medicine. When a new drug comes out on the market, and by the way, there's been 2 new drugs recently released in the United States for depression, there's always a good-looking pharmaceutical representative coming to my office offering to feed our entire staff lunch so they can get 15 minutes with me telling me about this drug and about the side effects and how to use it. When a new study comes out showing that a type of exercise called intermittent training significantly helps for major depression, there's no good-looking exercise physiologist coming to my office to tell me about that study. There's not even a bad-looking exercise physiologist coming to my office to tell me about that study. Why is that the case? Because if I put him on IT, no one's going to make any money in regards to that. Now, it's not because physicians don't want to help their patients. They do want to help their patients, but they only know what they know. And often, physicians are going to be experts in pharmaceuticals, and they're going to be experts in surgical therapies. But they're not necessarily going to be experts in nutrition and a lot of these other lifestyle things because they haven't read the studies about it. And unless they happen to come to a course that I'm teaching, which the American Medical Association has certified me now to teach a 10-hour course to physicians, telling them about all of these things and educating them, unless they've heard that course, chances are they're going to only have drugs and maybe a surgical therapy in their armamentarium. Now, I wouldn't recommend surgery for depression. By the way, some people are actually doing that. They're trying to implant electrical devices in people's brains, and there's studies being done on that now for treatment-resistant depression, and it can have a little bit of response, but then there can be significant side effects and headaches, and suicide rates are high with utilizing that as well. So go to some simple modalities. These 100+ modalities, a lot of them are very simple and can be used very effectively. I began utilizing these measures with wonderful results, and also what we think affects who we are. And so the cognitive behavioral therapy is also important. But once the program was utilized, I began seeing unprecedented improvement in many patients. Some had been chronically depressed for years. And one of them was actually my receptionist who I treated. And she got better, and she was the one who inspired me to do more with it, because we were now seeing a lot of people with depression in our office from all over the country, and she says, you can't see every depressed individual, Dr. Nedley, you need to write about this. And so that's how we wrote the book Depression the Way Out, and that's how we ended up producing a DVD series. By the way, some of you have inquired about the DVD series. It is over at the ABC. But the DVD series is utilized as home-based mental health education program where you can go through the DVDs and workbooks and learn how to put these modalities into your life. Or even better yet, you can become certified as a trainer to put this on in your local church or local community. And so in many places throughout the world, people are putting on a mental health education program. You actually send the results to us before and after, and what we're finding out is just attending this mental health education program, you don't have to be a doctor to put it on because it's education, but just attending this education program brings about results superior to any medicine on the planet. Now, some people, their depression is so severe that even if they attend this program, they might be interested in it, but they're not implementing any of it. And that's why they need to be sent to us to actually go through our program, because we don't allow them not to get up at 6 o'clock in the morning when they come to us. We're knocking on their door. We're making sure they're getting the light therapy. We're, of course, feeding them. We're making sure they get their exercise. And so they're mandated to follow a program. And after 7 days, it becomes optional, but after 7 days, we don't have to work with them at all because they are starting to get so much better. They see the results, and now they're motivated to actually continue this program on. But you can, through the internet, actually, through our website, drnedley.com, actually log on and take this training course and be able to put it on in your community. You'll get a lot of other books and educational material for that. But I would encourage you, someone just told me in South Africa the program isn't being utilized. And so it might be a good time to make bridges with your community. So often statements you'll get are the same statements I get when I started this program. You've given me my life back. One man says, "You've given me my wife back." He said he had lost his wife to depression, so to speak, even though they were still living together. And now he had the wife back that he married. "Doctor, I hope you don't mind, but I'm going to hug your neck." It is pretty dramatic what happens. And then I began to get brave. I began to realize that these people, since they were doing so well, might not even need medicine. And 90% success rate in those who adhere to the program of getting off medicine and not relapsing. Such patients often feel better than they felt their entire lives without the medicine. They're getting more done, they're more efficient, their social problems vanish, and they're able to concentrate and accomplish advanced planning and thinking. This one lady, this is a program that we held a few years ago, but this lady's story has been told in a peer-reviewed journal. I didn't write it up myself, but actually her PhD psychiatric researcher nurse wrote it up. This woman had been so depressed. She had been depressed for about 10 years, progressively so. And she worked, and she was a professional. She worked at a nursing school, actually a master's level nurse. And she had become disabled from her depression. Her house was an absolute wreck. You had to actually kind of pick your hole as to where you're going to walk in the house. And she recognized things were bad when her son gave her a list and says, "Mom, please get this food. There's no food left in the refrigerator. At least get this." So she wasn't even keeping up with her son. That's how severe she was. And she went to a psychiatric institution for 6 months. And at the end of the 6 months, the psychiatrist said, "I have to permanently disable you or you have to go to shockwave therapy." And instead, she came to our program on 4 different medicines: severe anxiety, severe depression. And she thought her case was hopeless. I remember even other patients thought her case was hopeless because she was falling asleep in the bus coming to our program. She couldn't even seem to motivate at all. And I told her, "No, we've treated people just like you. Hang in there." And at the end of the program, she was off 2 of the medicines. She was now on 2 medicines, and her depression and anxiety were significantly better. But with the long-term course that she had suffered, when she came back and told the doctor she was now just on 2 medicines, he said, "You've sabotaged yourself. You not only have depression, you have anxiety. You're going to relapse. You're going to go back into all this again. What have you done?" And she almost started crying there, thinking, what have I done? You know, have I been really this bad? And then she thought, you know what? I'm doing actually pretty well. I'm going to continue on the course. So we had a discharge recommendation with the course of being able to get off the medicine. Then she was down to 1 medicine. A month later, she was back to work part-time. And then she got off the final medicine, and she showed up to her psychiatrist so that he could tell her work that she could go back to work full-time. She goes, "I want to go back to work full-time." He did the test. He says, "You no longer have any depression and anxiety. What medicine are you taking?" "I'm not taking any medicine." And he says, "Okay, you get to go back to work full-time." And he walks out of the room, says, "See me again next month." And then he walks back in and says, "Wait a minute. You're not on any drugs. You don't have depression and anxiety. You don't need to see me at all. You don't need to have an appointment." He walks out again, and then he walks back into her room the 3rd time, and he sits down and he says, "Tell me about that program that you went through." And now this nurse actually goes to that behavioral medicine unit and actually tells about her experience and tells about all of the other things that can help depression. And she is very successful in what she does. So in summary, don't wait for depression's complications. Get on the best pathway to health of mind. Implement thoughts that will change brain chemistry for the better, and make the choices that will positively impact your life long term. Now, I would like to open it up for a few questions and answers, but I would also like to say this. Tomorrow is my last talk, and I will not be answering any questions after that talk because of the schedule that I'm having. So if you have questions, now is a good time to ask them. And then I know some of you have already scheduled some private appointments with me afterwards, so you can see me with that. But after this presentation and what I do here afterwards, that's going to be it as far as the questions are concerned. But I'll take questions from the floor at this time, if you have any, and we might need to rove a microphone around. But if not, I might be able to hear the question and repeat it until we get a microphone here. Yes. Go ahead.
He's been on morphine for pain killing ever since. And now they are wanting to put the electrode up in his spine with a control to help him to contain the pain that he still suffers from that time. Would that be a good thing to do, or how else can he get rid of the pain?
Yes, okay. The question is about her son who has had sarcoidosis and had to have surgery for the sarcoid and then had to have a repeat surgery within 3 weeks and is now suffering from chronic pain due to, it sounds like, complications from the surgery. And it has adhesions as well and scar tissue. And so this person is on morphine chronically, and is there hope for this individual to control the chronic pain? All I can tell you, I'd have to have, of course, a little more data and be able to see this person, be able to tell you all of the chances and recommendations. But in general, worst case scenario, if he goes through a mental health education program, is his pain will not worsen, but his coping mechanisms will significantly improve to the point where he'll be able to get off of those drugs and actually live a far more successful and happy existence. That's worst case scenario. Best case scenario is by improving the mental health, the pain aspect will actually get far better. And so this is why we, as mentioned, with headaches, also with fibromyalgia, we have a lot of success with fibromyalgia and those type of problems. And then there may be some medical things that we would add to it to help the pain, not medications per se, but things that can help replace the pain medicine that are natural therapies that might be able to help even in regards to the adhesions that could add to that. All right, question right back there.
A colleague of mine, she's 25 years old, and she's been away for 2 months. She started having severe headaches, and the psychologist told her that she has a major depression. Now she can't remember, like she has to write before she can, like if maybe you tell her something like at work, she has to write it down. If she doesn't write it down, she forgets. She has lost weight, and sometimes she came back only on Thursday, and she was like, she lost her mind a bit because she kept on laughing. I don't know what is what can be done, because she's really, and she's staying alone. What she told me, she was saying the things that she thought she was like in her life experience, she thought she dealt with those problems, but she didn't. That's what she told me, but she's getting worse every day. And they give her like 15 pills a day, and then she sleeps a lot, and she can't, like, she's worse.
Well, it sounds like the very typical person that we treat in our program. All of those things are symptoms of a mental illness, and it sounds like depression on top of anxiety with the complications of the memory and the mood swings and those sorts of things. So, I mean, the first thing I would do is try to find the underlying causes in her, maybe getting, for instance, the DVD workbook series. You'll actually take a test as part of that series to see what's there that can be individualized for her, and then we work on reversing those hits that are present, and that's how we get the results. And of course, if at all possible, if that doesn't necessarily produce the result, trying to get her over where we actually run the treatment program would no doubt produce the desired benefit. Yes?
You mentioned inactive, thyroid in your questioning for
Yes.
depression. What is the effect of an underactive thyroid either in depression, mental health, even physical health?
Well, yes, it of course affects physically and mentally. You'll slow down mentally, and so you can slow down to the point of having depression. You'll also slow down metabolically, so it's very easy for you to gain weight. even though you're not eating a whole lot. You'll tend to get in later stages what we call myxedema. It is swelling, but you'll try to pit to see if there is fluid there, and it'll be called non-pitting edema. And those are the more classic characteristics. Of course, memory can also be affected as a result of that. So thyroid affects just about every organ in the body. It also, if you're not producing enough, your cholesterol will go up as well. All right, I don't know who has the microphone next. Is it someone? Yeah, someone right back behind you there? Yes.
Okay. I have a daughter. I think about 2 years ago, when my sister got ill, okay, the real mother now, she had this mental illness condition. And first they said she has microscopic behavior something. Then my sister passed on. Then she went back and they said it's post-traumatic disorder, was on treatment. Then later she's worse, she goes back, it's okay, bipolar mood disorder. Okay, now she's on treatment, and then you think she's getting better, then she gets worse. Now they change the treatment to something else. And now she's extremely slow. She's a very clever child, top student, can't write exams at university for 3 years in a row now, and she's out of the school. My question is, from your observation, how easy has it been from a child or patient from a foreign country to access your center? That's all I'm asking.
Okay, well, I mean, you can assess our center pretty easily. One of the reasons is we don't start filling up our program until 3 weeks before the program begins. And so at the 3-week point, anyone can assess or access the program by calling. They have to get screened. We want to make sure that they're a good candidate for the program, but I can tell you just based on what you told me with your daughter, she would be an excellent candidate for the program. And then just find a way to get there and get it paid for, and they'll be able to get into the program. Now, of course, a lot of people say, well, how do I get it paid for? But again, what I mentioned earlier, if you do make the call, our individual that does the screenings has all sorts of ideas on how funds can be raised for the individual. And if any individual desires to come to the program and their family desires them to come, they're going to be able to find the funds to be able to come to the program. Once others who have the money that can help them out recognize the value of the program. And so, as mentioned, most of our people don't have money to be able to come to the program, but they were able to raise the money to come. What you might do in the meantime is get a hold of the book Depression the Way Out, the workbook series, DVD series. That's a good way to start, and if that takes care of it, it'll save you a bundle of money, and that can often help. All right, let's take a few more questions. Let's see.
Dr. Nedley, here's a question. If someone suffering from epilepsy can benefit from the program?
We do take epileptics into the program, and they can benefit from it. However, we do not state that they'll be able to get off all of their epilepsy medicine. It's a different likelihood. Most of them are able to get off their depression medicine, but not necessarily all of their epileptic medicine. But what helps the brain for depression does make it less likely that they'll suffer a seizure. So it can help. Yes.
Doctor, is bipolar just a fancy name for depression? And can it be reversed with a plant-based diet and exercise?
Okay, what about bipolar? Is it just a fancy word for depression? No, it's a form of depression. You can get severe depression with bipolar disorder. But what sets bipolar apart is you have mania phases. A mania phase is where you don't sleep for 2 weeks, you're up doing a lot of activity, pressured speech, but you're not really getting anything productive done. And so you become a nuisance to everybody around you. You think you have all of the answers for everybody around you except for yourself. And the mania phase can get so severe that you end up preaching in the middle of the street with your clothes off. And that's when you end up being in the hospital and trying to get the mania phase slowed down. And so that's bipolar disorder. Can it be treated through nutrition and lifestyle measures? Bipolar 2 can be easily treated through the nutrition and lifestyle measures. Bipolar 1, the brain is so scarred that even though they'll do far better with the program, we take bipolars of both cases, but bipolar 1s will still end up needing a mood stabilizer, not an antidepressant, but a mood stabilizer to stay on. Yes?
I just want to find out, will it not be possible? I have two people in mind that I know that are close to me that have got the same problem. And I see there are a couple of people. Would it be possible, instead of maybe everyone trying to send their people across the sea, for you to come maybe with your team for a week? I mean, it's 10 days. We organize this somewhere. It might be cheaper to fly 5 people, not to South Africa, than to fly individuals to the... Can it be something that gets coordinated, and then perhaps even when you come, you train people who may want to take this, this seriously? They can be trained whilst you are running this program.
Okay, good question. What about training people in this area to be able to put on the program in South Africa is the question that is made. And we are very willing to do that. We've developed a training program that has to be professionally based, but there's a lot involved in that training program. And what we want to be sure of is that, number one, you have a facility that is going to be conducive to running the program. You need to have a good physician who's going to be trained. You need to have a good clinical psychologist that's going to be trained. You need a good spiritual counselor that's going to be trained. And you need a good administrator of the program that's going to be trained. And so that involves actually 4 different people that have to undergo intense training. And so that's a lot of investment in funds and resources, but it will pay off because we'll actually promote your program in South Africa if you do all of that. But those are the ifs that you have to line up in order to be able to even qualify to get the appropriate training to do the program.
My question was, won't it be possible for your team, if we get all people who are suffering from this, at one point, that your team fly into South Africa, perhaps people who will be concerned around here, they raise funds together, and then they pay for your ticket to come and perhaps you accommodate.
Well, that actually is part of it. That's part of the training. But the first thing those 4 people have to do is come to where we do the treatment and see us actually go through a program, and they shadow us in that whole program. The next step is we come over here as we run the first program under you guys there to make sure that you're set up to be able to do things well. And then after that, you can be set up to do it. So it requires both of those, and that's why there's significant fund outlays, and you'd have to, raise the bar to be able to do this. But we do want these programs, and we know that the demand for this is going to go up because within a year, we're going to be publishing in some major medical journals, and so this is going to go like, when you consider that 26% of the developed world, 26% of people have a diagnosable mental illness. A major diagnosable mental illness. That's 1 in 4, and most of them have not been able to be adequately treated here. Once the word gets out that there is a solution to all this, we're going to need a lot of centers all over the country, so we'd be glad to have you guys on the front end of it if you have the wherewithal to actually put it together. Well, you've been a very attentive group. I just want to make sure if there's no one else with a burning question. Oh, there is someone up here, so let's take the burning question, and then I will wrap things up.
Thank you, Dr. Nedley. How prone would a depression sufferer be to Alzheimer's?
Okay. What about this program in relationship to Alzheimer's? I can tell you this. There have been many patients misdiagnosed with Alzheimer's who actually have depression. We've had individuals that can't even remember their children's names and have been laid off of work because their memory is so poor. They can't even find their room when they come to our place. That's how bad they are. But in our screening, we recognize that depression was a major component of that. And when they go through our program, the memory does improve. But if it is an advanced Alzheimer's patient, and we're convinced of that, we can't get rid of the neurofibrillary tangles that are already there. And so that is going to have to be there. But I can tell you that even if it's advanced Alzheimer's, there's some things that advanced Alzheimer's patients can do to actually improve their Alzheimer's. There was a recent study showing that even advanced Alzheimer's patients can learn how to play the violin, for instance. And when they learn a musical instrument in the process, they'll start remembering the names of people that no one ever even knew that they knew their names. One was on an Alzheimer's unit, been there for 10 years, had the same nurse taking care of him for 10 years, did not know the name of that nurse. And after several violin lessons, the nurse came in and he smiled at her and called her by her name. First time in 10 years. So there are some things that can improve about it. But if it truly is advanced Alzheimer's, it would probably be better to go through modalities like that than to actually come to our program.
How prone would a depression sufferer be to getting Alzheimer's?
They're actually more prone. Yeah, they're more prone. And studies are indicating that if you have depression, the more severe the bouts, the longer it lasts, the more likely you are to develop an advanced dementia. And that's why it's better to come to our program before that advanced dementia starts. And one of the certifying things that we do if someone has advanced dementia is we'll put them through a memory test to see if it's related to depression or to Alzheimer's, and we have a way of helping to differentiate that in a specialized memory test. Well, you've been a very attentive group. I've certainly enjoyed being with you the last few days, and I'm looking forward to my last time with you tomorrow morning. But I wish you all the best of health of body, mind, and soul. Why don't we close with prayer at this time? Father in heaven, we thank you that you are interested in our health. And we thank you that you also have special concern and compassion for those with mental illness. And we also thank you, Lord, for what you have done through science and inspiration to show us a way out of mental illness. And so we pray, Lord, that you would bless the information that's been presented today, that the people here would be able to tactfully utilize this information as well as share it with others, so that we can all live a more abundant life in you. We thank you for hearing and answering this prayer in Jesus' name. Amen.